This segment of Delmarva Life is brought to you by TidalHealth.
A week ago today, we celebrated the holiday of hearts, Valentine's Day. Many of us made that extra effort to make sure our loved ones know how we feel about them. Today, we're still going to talk about the ticker.
Talking about the ticker, but we're honing in on heart health because knowing the risk factors and the symptoms of a heart attack can mean the difference between life and death. So, joining us this afternoon is cardiology specialist Dr. Christian Bounds with TidalHealth. Thank you so much for joining us.
Thank you for having
Being
me.
here.
Okay, so explain to me in a nutshell why it's so important to recognize the symptoms of a heart attack.
Because time is muscle. That's one of the key mantras we have in our practice and in our specialty. Is that the longer you delay getting help that you need, the more damage of the muscle of the heart that is occurring.
Yeah.
So,
okay.
Yeah, okay. So you start getting symptoms.
Start getting symptoms, even if they're vague and you don't know what they are, rather have you seek attention than to delay and try to figure it out yourself.
All right, so CIC, what is a cardiac interventional center?
So TidalHealth Peninsula is a cardiac interventional center, and what that is designated by MEMS, which is the institute that controls all the emergency services throughout the state.
Okay.
And they've designated us as an interventional center, meaning we have a goal of getting people's vessels opened in a very short period of time, 90 minutes, door to balloon, we call it. From the time the patient hits the door to the time we're inflating the first balloon to reestablish flow, the goal is 90 minutes.
Wow.
So what that allows the emergency services in the area is to divert from a hospital or drive right past a hospital that doesn't have interventional capabilities to come straight to our hospital to be able to do that. And when I say ours, also Nanticoke has the capabilities as well.
Is that cardiac catheterization or is that something different?
Yes, no, that is catheterization, exactly. And we go on to do what's called an intervention, which is when we actually do something to open the vessel. So the catheterization, think of it as a diagnostic tool. We look to see what's going on, and then we decide whether it's appropriate, and in those circumstances, it's most always appropriate to open the vessel, either with a balloon or a stent or a combination of the tools that we have at our disposal.
So catheterization is just looking.
The catheterization is the process of looking, but during the catheterization, through similar catheters that we use to look, we actually do perform the intervention. There's subtle differences in the catheters and the tools we use.
Gotcha.
So when it comes to the heart, prevention is key.
Absolutely.
So there are risk factors.
Yes.
What are they?
So there are modifiable and non-modifiable risk factors. Obviously, the non-modifiable are your genes. You can't control that, but you can control your lifestyle. You can control what you eat, how much you exercise, and taking care of your blood pressure and seeing your doctor regularly to take care of those risk factors. Cholesterol, blood pressure, smoking, of course.
So I have seen some apparently healthy people who exercise, they watch what they eat, and they can still have a heart attack.
Correct.
Nobody's immune.
Nobody's immune, that's exactly right. And again, some of that's genetic. A lot of that's probably driven by genetics.
Okay.
You're not going to escape that, unfortunately.
So everybody needs to pay attention to what we're talking about.
Pay attention to the symptoms, see your providers regularly so that you can control your risk factors and modify what you can.
Yeah, and even if you are not genetically disposed, you should go see your doctor, have that conversation.
Absolutely. Making sure that you are getting it under control, and not just so you see the doctor every 6 months or whatever, but every day. The choices you make every day are as vitally important as going to see a provider on a regular basis. So what you put in your mouth 3 meals a day or whatever, how many times a day, whatever you put in your system, whether you're deciding whether to sleep in or go to the gym, go to the gym, do something.
Yeah.
And it doesn't have to be go to the gym, it just means get out and be active and do something physical. So
yeah, a lot of life to live.
Absolutely.
All right, Dr. Christian Bounds with TidalHealth. Thank you so much.
Thank you very much.